Happy Tuesday. I am Jason Tierney with Transform Dental Sleep. Behind the scenes, we have my man Elias Kalanzis. That's Elias, not Elias, Elias. And want to welcome you all to Same or Similar Oral Appliance Therapy Expert Panel Discussion. We are hosting this because appliances are the number one topic of interest, followed closely by medical billing. Other than that, we've got a lot of interesting topics that we cover about communication, the consultative sales process. Almost no one cares. Everyone wants to talk about appliance design and medical billing. So we are going to state your needs tonight with an expert panel. The Before we introduce the panel, though, I want to cover a couple of quick housekeeping matters. We are going to, this is live. You can type in your questions down below, and we'll try to get to them as we go through when relevant, and then we'll save the rest until the end, but we will try to get to all of the questions. Additionally, if you stay on until the end, you will get your CE certificate, your AGD Pay CE certificate emailed to you in the next 48 hours. That means don't email me in an hour and tell me that you haven't got your certificate. You'll get it in the next 48 hours. If you don't have it by Friday, then give me a shout. Sound good? Sound good.
All right.
So the first thing I want to do is introduce one of our panelists, Dr. Stacy Lehman. Dr. Stacy Lehman has three bustling practices here and our three bustling offices here with her Go to Sleep centers in the Phoenix, Scottsdale area. She is a dynamo. She has a voice that you will never forget, and some goats. So, Stacy, what you used to have some goats.
I don't have goats anymore. And you
You
guys,
had some.
Jay is one of my very best friends. He's actually married to my best friend. But you know what's really funny is that when he says she has a voice that you'll never forget, he's saying that because my voice is annoying to him and Licia. So that's why he's saying that.
That's not true, but I'll let you all be the judge.
You can't even come. Yeah, okay.
And our next panelist is Dr. Brandon Hedgecock.
Where's Brandon?
Dr. Hedgecock is a longtime friend of mine. He has one of the busiest dental sleep practices in the world. He lectures all over the place, and nobody likes to talk about Dr. Brandon Hedgecock more than Dr. Brandon Hedgecock. So what else do you want to share with him? Hook 'em horns or whatever you guys say too, right?
Hook 'em horns. That's all I need to say. Also an annoying voice.
Oh, all right. Well, then that's three of us. So next we've got Dr. Suzan Tai, who has a luxurious voice that will annoy no one. Dr. Suzan Tai is down in Texas. So we've got three Texans on this panel. Three native Texans on this panel. Dr. Tai has a very busy dental sleep practice. She is also an author. And she is certainly the most esteemed karaoke singer on this panel. Oh, yeah, you are.
100%.
1,000%. What else would you like to share? Tell everybody a little bit about your son's dancing. It's pretty phenomenal.
Yes, I could talk about my son. My son is my world. But yes, so what Jason, he says singing, but honestly, I love dancing. If you haven't seen me, I'm always on the dance floor. Brandon's also a very good dancer as well. But my son kind of followed me, and now he is a dancer for the Dallas Cowboys. So he's 14 years old, getting a paycheck. It says Connor Tai from Dallas Cowboys. So I mean, it's exciting. He loves it, and he just cried when we lost really badly, and couldn't make it to the Super Bowl. That's the only bad thing, but it was really good.
There's always next year, I think.
That's right. There's always.
Yes. Well, thanks for joining us. And then my man, Sunny Bala, a non-dentist, is here. And Sunny is the owner and founder, CEO of Apex Dental Sleep Labs. They make a full suite of different oral appliances. And Sunny has touched so many cases, and he's lectured extensively. And I think Sunny will bring a different perspective, a lab perspective, to today's discussion. So, Sunny, you also tell Sunny to always wear his helmet when he's riding his mountain bike, because he is an avid mountain biker.
Don't judge because I'm from California also.
Yeah. You are certainly not a Texan.
Don't judge. I travel 22 to 27 weekends a year, so I'm not really from California, if that counts.
Yeah. You're a part-time resident.
Yeah.
Yeah. And then my name again is Jason Tierney with Transform Dental Sleep. I wrote a book by that same name. If you haven't picked it up, I encourage you to check it out, read it. If you have read it, I beg, implore of you, please spend 2 minutes and write a quick review over on Amazon. I promise I would do it for you. Now, with that said, type your questions in below and we're going to dive in. So this slide is really an amalgamation of a number of questions that came in. And I'm going to start with you, Stacy. Which appliance do you use most often for class 2 patients? Deep overbites.
Minimal vertical.
For example.
Thin minimal vertical. So either a nylon or a Evo, Somnus Evo.
So a nylon device like a Serena or a Panthera, something like that.
Yes, sir.
Okay. And Sunny, again, you're getting cases sent to you from all over the country, dentists everywhere. What do you recommend most commonly for a patient with a deep class 2?
Same. Either something like the Serena EMA nylon, just as little vertical as possible, as much tongue space as possible. I like the Serena EMA nylon just because it's got that nice lateral play without too much pull, especially for a deep class 2. Just minimize vertical as much as possible.
Got it. Would anyone here disagree with that, or do you have a go-to for class 2?
No, I second it for everybody. Those deep patients, when you use a device like a dorsal that requires a thicker amount of material, you're already opening them. By the time you take them from that deep bite and you take them edge to edge, you might have opened them already 10 millimeters. And then if you throw another, 5 to 7 millimeters on top of that, you're opening them 15 to 17 millimeters. And you'll see compliance will start to go down, jaw pain, soreness, discomfort will start to go up. And so I agree. I'm typically an Evo Select or a Panthera or a nylon, something like that.
Okay. And then Dr. Tai, what about, I know for a long time, people thought that edentulalism precluded patients from an oral appliance. Do you have a go-to device for edentulous or partially edentulous, or mostly edentulous patients?
Sure, I definitely do. I do love the Herps Advanced Elite by Somnomed. Their B-Flex liner just has such a nice cushion, and it has such a good hold on those ridges that it just seems to hold so well. And so making it is easy. It's not too hard. You get your wax rims. We use Airway Metrics to get the bite. And, they make this appliance, this Herps Advanced Elite, and it just holds, and patients put it in. And if they have a very thin jaw and they can't, then I will say put some of the oh my gosh, Polident, something like that on the bottom, not Polident, but the Fix-It to kind of hold it if they need to, but they seem to do very well. So yes, that's the appliance of choice for me when it comes to dentalist patients.
And patients are pretty compliant with it as well?
They really are. They do well. And so it holds. It really does. And so I like to do it on actual tissue and jaw instead of putting on top of dentures, because dentures,
Sure.
It's a lot in the mouth. And so they seem to do just fine.
Got it. And what about Stacy for Bruxers? What's your go-to?
I don't I don't really, I guess back in the day, I was a little bit worried about that, but now I don't worry about it at all with the ProSomnus Evo.
Yeah.
I
Yeah,
don't.
that seems to be like it's sort of yeah, the newer iterations of devices, it's really not an issue, right? There's been so many advances in design and
Yeah.
material quality.
Yeah.
Yeah,
I don't.
back in the day, we were doing. Oh, I'm sorry,
Oh,
Stacy.
go ahead.
Well, I was gonna say, back in the day, everything you put in a Bruxer would break,
Yeah.
and we were doing these heavy metal reinforced, like the SUAD, like these tanks that we
Yeah.
would put in there. And but Stacy's right, like the Evo material now and Evo fits about 80% probably of my patients, to be honest with you. So if you're worried about it, you can move those posts out a little bit to allow for a little bit more play. And I just don't see them break that often. If you have someone who swings a lot, I would consider like maybe an Avant. It's not my favorite device, but I think it works well for patients who really swing and they like big time bruxers. That you need a little more play than what you can get even with moving those posts out on the ProSomnus.
And with moving those posts out, is that something that you're stipulating when you're ordering the device? Okay.
Mhm.
And with the Avant, so you're saying if they've got a lot of lateral, like extreme lateral excursions, lateral bruxism patterns, that's where you'd probably lean toward an Avant.
I would for someone who's extreme bruxer, or maybe they have a lot of deviation or deflection in their bite, because the second that you go to a bilateral stop type of device, um, you're going to risk, as they deviate or deflect, you're going to risk one side hitting first before the other side, and so having that anterior, um, connection point kind of minimizes that risk.
And
Got
going
it.
back to the edentulous, if somebody doesn't, if they've got really no posterior teeth and not enough teeth to get like a ProSomnus or something like that, the Avant with the liner has so much more grip, and you don't need the posterior teeth because the connection is in the front.
Got it.
Yeah.
And
Yeah.
Sunny, since at your lab, well, and not just at your lab, I mean, you've touched so many appliances in lectures. I mean, what would you add to this regarding bruxers and device selection?
Yeah, so for what comes into the lab,
Yeah, because and one other thing I'd add to that, I mean, most of you're seeing a lot of broken devices, right? You're seeing
yeah,
our dentists sending cases back going, this piece of whatever broke. So how do you kind of what kind of guidance do you provide there?
well, I learned the most from breakages. To be honest with you, that's really when it's anybody can talk about an ideal scenario when a device works. When it doesn't work is when we learn the most, and that's the phone calls I actually like the most, is because it challenged me to figure out what happened. And some questions may be more invasive and says, doc, did you check your bite? Is your bite off, right? And maybe that's what's created it.
That's a stupid question, Sonny.
Well, well,
The
at the
answer
same
is
time,
no.
yeah, well, they've all brought up some good points, like especially with the edentulous case, as a lab, we have to ask, it's really important that we ask important questions such as, does the patient prefer to have the dentures on at night? That's a limiting factor. If the patient must have their denture and they want to wear that exact same denture at night for whatever reason, we have to design something around that. Now, if the dentist does not want them to be wearing that denture and they want to relieve some pressure, the next question is, what's the ridge retention like, right? And so one advantage that you have when you're considering making on a device, it doesn't matter what it is. If you make it on top of the existing denture, guess what? In the event they ever have to have an internal reline for additional retention, that sleep device just piggybacks off of it. So there's a mechanical advantage to that, right? So there's a lot of things to consider. So all these points, I love the doctors talking about this, because for me, I have more questions than answers. Usually when an appliance comes in broken, I end up with more questions than answers, and that's how we get to something. And as a lab, I'm agnostic. I mean, I'm like NASCAR. I make all the appliances on my lab brochure. It's all the different devices, so I can truly speak agnostically. And I'll direct you to whichever device I think it is. If it falls on that I recommend Somnomed, which you don't make, I've done that before. A lot of it is just being objective to what it is that the doctor is trying to accomplish and what the patient's needs are.
And I would be remiss if I didn't mention to all of you guys that are dealing with edentulous patients that I also still have a very busy dental implant practice that we can help those patients out. Because that's really the best solution is get some implants and then make whatever device you want.
Well, that brings us to this next bullet, and we'll go with you, Brandon. What about patients with pending restorative work? Patients going to get a crown, whatever it might be. What do you
Yeah,
do
this
there?
is one of my pet peeves. It depends on how much restorative work that is pending. And one of the things that I run into a lot of times with dentists is they almost want to hold their patient hostage to completing dental work before they'll make them a device. And I just think that's the worst thing that you can do. So, this patient gets referred to you from a physician and they want to sleep better, and you tell them they got to get 14 crowns before you can do a device. And I just don't believe in that. So that's my soapbox, and I'll get off that now. And what I would say is if the patient's got 1 or 2 crowns that they're going to get and they're getting them in the next week or two, no big deal. Hold off on the impression, have them get the crown and go for it. If they got 1 or 2 crowns they're going to do and they're going to get it in the next year, you can pretty much do anything. I typically will do an Evo, and we can make that device we can adjust that device around the crown, or we can talk to their dentist and have them make the crown so that it still fits in their device. That's pretty easy to do with today's technology. If they're getting a full mouth rehab and they're going to be going through extensive dental work and they're already signed up for it, then we may want to talk about a temporary device, or we may want to use something like with thermocryl that we can reline and reheat and reuse over time.
That's right. I was going to say also to Brandon's, when I tell patients, if they have dental work that needs to be done, always bring, because in their cases, they'll get their models. So they can at least bring their models. So if they need a new crown, anything like that, then they'll have the models for the doctors to send to the lab so they can make crowns to retrofit also. But when it comes to thermocryl devices, there's a number of them out there that do well. You hear about TAPS, you hear about Dynaflex has an AccuFit liner. You also there's a Morpheus device that also has a thermocryl liner as well. And so that can help. But I'm with Brandon. I definitely do not want to wait until patient gets all their dental work done, because they may not, how many of your patients get all their dental work done as quickly as you wanted? You're waiting a year, 2 years sometimes, and that's just too long to wait for them to breathe. And so we discussed that in detail. I asked, okay, I see that you've got some teeth that might need some work. When do you plan on getting that done? And if they say, just like Brandon said, if it's not happening within the next month or 2, then we let them know that, this may not completely fit, but we'll do everything we can to make it fit. And what would you like us to do? And we usually push forward with the appliance. And like Brandon said, it could be any appliance. We say any appliance. It just depends on the teeth. Depends on what you see, range of motion, teeth, curve of speed. So there's a lot of amazing appliances out there, but there's things that we have to look for to kind of choose the appliance.
So Dr. Tai, in that situation that you just described, though, I've heard these conversations, or I've had these conversations with dentists where the dentist then says, yeah, but I'm going to make them one of these, and then they're going to have to pay for another one after they get these 3 crowns. And I'm not going to eat that. They don't have the money for it. So we'll just wait. What do you say to that dentist?
When patients say that, or I'm sorry, what did you say?
So a dentist says, so basically I share the sentiment that you just shared with a dentist about their patient. And the dentist then says, my patient will have to pay for another device then. And they're not going to pay for it. And I'm not going to eat the cost of another device. So we're just going to wait until they get their restorations done. And then I'll make them a device. How do you help that dentist understand? Because there's probably someone on this session tonight hearing this that's thinking something like what I just described. How do you help that dentist get over that hurdle and truly understand the import of that patient breathing and getting a device ASAP?
Of course. And when I my mindset had to change. I mean, I was that dentist as well. I thought, how could I do this? How can I make a patient pay for another device? But when you see these patients come in and they stop breathing 20, 30, 40, 50 times an hour, and they are suffering, they're falling asleep as you're talking, and they've got AFib, their cardiologist sent them to you to take care of them because they have AFib and they have many other issues. We're treating the medical side, we're treating their health, not necessarily their teeth. But again, I would talk to the patient and I'd be very upfront. And I would say, this is the thing, we can have this device and I can use, if you're going to get this much dental work done, then yes, we can use a thermocool device and we can go ahead and use that. So we can, and that's what you can tell the dentist too. They can use a thermocool device. And as they're going through dental work, then finally get the final device when it's time. But ask the patient how long that's going to be. Is it going to be a month, 2 months, a year? And then, like Brandon said, a lot of these devices you can retrofit. So if it's a couple, 1, 2, 3 crowns, we can retrofit it majority of the time. And plus, bring the cast to the dentist. That whoever, I always tell my patients, bring it to every single dental appointment, even if it's hygiene, because sometimes you go into hygiene and the dentist says, oh, looks like you need a crown. Let's go ahead and get it done. Same day treatment. Let's make it happen. And we'll say, what? Before we start, doctor, can you please, I have the sleep appliance and I have my cast. Can you please make sure you retrofit? Or, I mean, I know some dentists are very wary of making other dentists upset, but I tell all the patients, I said, have them call me. If not, no worries. I have no problem talking to any dentist that wants to call me and kind of fight on it. But
Dr. Tai, you're going to have to explain hygiene to Stacy. She's got a weird look on her face. Like, what is that?
Well,
Thank God.
It's one of the
Thank Lord made this.
well, actually, let's pass the baton to Stacy because with this next question, there were this is probably, I mean, there were, I don't know, 300 people or something like that that registered for tonight's webinar. And the most common question had to do with TMJ pain, with joint pain. So what device or what steps can you take to mitigate the risk of, people call it TMJ pain, of course, most of the time it's muscle. But can you just talk about that for a moment, how you select a device and what you consider?
How much time do I have?
You've got 43 seconds. Go.
Okay, first of all, the morning aligner situation is a disaster. You're asking a patient who's been held in a position all night long to wake up and immediately reset their bite. And I stopped that many, many, many years ago. And we use PM aligners. So the patient is not to stretch or do any kind of anything with their jaw for the first 30 minutes. Go about your day, use the aligner in the evening to make sure that the muscles pull jaw the way back. It cut down our pain patients by 75%. Second, I think Brandon mentioned, if you've got somebody with a major deviation, deflection, or if I have a patient with fibromyalgia, major like crepitus and popping and clicking, limited open, like they're hot, their joints are hot, I'm going to put them in a Serena EMA. Serena EMA is going to allow me to progressively move them forward, but they have a give. The rubber band has a give to it. So I think people make it out to be this big deal. I tell people, this is not going to cause TMJ. This is a treatment for the majority of the bad TMJ stuff. It's going to protect the joint, unload the joint. So is my 40 seconds up, 43 seconds up? So that's
you got 12 more.
Oh, damn, I went really fast. I think people worry too much. I think that's one of the main things that people are so afraid to jump into this because they don't understand TMJ. You don't have to fully be a TMJ specialist and understand TMJ. You have to understand the basics, that when you open the bite, you're unloading the joint. And so all the only thing that can happen truly that is a problem is muscle and tendon problems.
Yeah.
You start them in a good position and you move them out slowly, and you're not too aggressive, and then you get rid of the AM aligner. Use an aligner, just not first thing in the morning. Your situation with pain will be very, very low.
So Sunny is nodding gleefully, like preach, sister. And Sunny, that's really your genesis was in the world of TMJ. So can you just talk a little bit to this point as well?
Yeah, so just like the Stacy, just like the electoral debates, when somebody tells you you have 12 seconds left, you gotta end it with Stacy 2024, right? But as when it comes to this, TMJ is definitely my background, and it's really become an advantage for me when it comes to making sleep appliances, because my goal is to essentially help the doctor create a sleep device that doesn't compromise TMJ. You do not have to compromise it. And again, I can't emphasize this enough. It's the bite, right? And if you get your bite correct, the device, doesn't matter what it really is, it's just a catalyst for that position, right? From that point, secondary to that is going to be, doctor, how would you like to control that position? Do you want to be rigid in the control, or do you want lateral movement, right? And it all depends on what the diagnosis of the TMJ is, right? Some patients want to be limited and restricted, and therefore the Herps, the dorsals, and even the tap will be great for that. Hold the position right in center. Well, if you want them to have lateral play and lateral range of motion, then the EMA would be a great choice for that, right? So it depends on what the doctor's diagnosis of the TMJ is and how they're trying to control it. Now, be mindful, some devices that are soft and spongy, clinical research shows that it does increase parafunctional activity. So dual laminates, things that are soft on the liner can increase parafunctional activity. You have to determine whether or not that's a factor in your decision making or in your appliance choices or not.
Right. Let me just, I want to chime in there for 1 second, Sunny. So something you just said there, which I appreciate, is with some patients, a soft liner can increase parafunctional intensity, right? It kind of gives patients something to clench into, so they clench more. But that's not a hard and fast rule. It's not, if you give your patient a soft line device, it's going to cause them to clench harder, clench more intensely, clench more often. That's not it. If you have a patient whose wear facets maybe, indicate, that sort of activity, then yes, this is a factor. But it's not an all or nothing proposal, right?
100%. And the materials, it's right now the doctors really have a playground with materials, because you have the Evo and you have the Avant with very thin, soft material. So therefore, it's a soft on the impact to the teeth, the surrounding areas as it grabs onto it. But again, when it contacts, it's still a pretty rigid contact. But if you make something that is dual laminate, like everybody knows is 2-to-1 ratio, 2 soft and 1 hard, that's going to be a very spongy type of bite. So again, there's tools. The doctors right now have a playground when it comes to the tools of what they want to do with their patients. But the fact that they just check TMJ is a huge accomplishment. If you just check the TMJ and check to make sure that your bite, if the patient's deviating or deflecting to one side and your bite does not mimic that, you need to ask yourself. And I tell everybody this all the time, muscle against the appliances, the muscle wins every time. I learned that when the days with the silencer, when we were making them out of titanium and they're breaking them. When Patrick Strong and the Suat, they were still breaking them. But
So what about what about then, regardless of hard or hard soft, dual laminate? What about there's a question about the adding an anterior discluding element.
So I was going to just mention that, because one thing is, the majority of our patients don't have TMJ issues and won't have TMJ issues. But when you do your exam, you might have some patients who already have TMJ issues. You've got these patients that already have hot joints, hot muscles, tenderness to palpation, limited range of motion, pain on palpation. And those patients would be the big time clenchers and stressors that I would maybe consider doing an anterior discluding element on. Again, trying to minimize vertical, setting them in a little bit more of a neutral position, anterior discluding element to try to minimize that clenching and move them a little slower, like Stacy said.
I second Brandon. I love adding anterior discluders, but after the examination, and if there's a history and you find out that they say they've had TMJ, or they brux and they grind really heavily and they've had pain, but maybe they don't have pain that day, but you do let them know that there's always a possibility they could. So you kind of add an anterior discluder, because at least if the vertical is too high for them, you can always take it off. So you can lower that
Mhm.
vertical and that can help. And so it's great because what do they say? They say like when you have an anterior discluder, then it can decrease clenching by 75% in anterior temporalis, right? Or 55%
Yes.
in the masseter. So I love placing anterior discluders when I can, or when it's necessary and needed. The other thing,
Mhm.
like you said, slow moving. So again, going back to certain appliances, the Herps Advanced Elite, at least it moves very slowly. It's like a tenth of a millimeter every time. So you have people who are really slow. You want to be very careful you do that. Also, when you're getting your bite, you may not want to put it at 75%. You might want to put it at 40% instead of, go
Mhm.
that far. So you have room to move slowly. That's just what I would suggest.
And Dr. Tai, what about when we're talking about side effects? What about tooth movement? Are there devices that you use that seem to result in more or less tooth movement than others?
So tooth movement, I know, I know, Jason, you said, well, we're talking about oral appliances and things like that, but I can't stress enough how much I prepare the patient. And I talk about that there's always a chance for tooth movement. And verbiage is huge. So yes, tooth movement can happen because you know why? Teeth are in constant movement. And I give them the example of, when you had your braces and you might have been in braces for 5 years, but did you wear your retainers? And they'll say, no, I didn't wear my retainers. Okay, have your teeth shifted. And they said, yeah, it did. Well, can you still eat, chew, smile, talk? Can you still do those things? They said, yes. And I said, okay, so the teeth are doing what they need to do. But if we wear this appliance and now you have more energy, you're not falling asleep, where, your mood's better, preventing heart attack and stroke, which one makes more sense to you? Which one's not makes more sense? Which one's more important to you? Because if you're worried about tooth movement, then this isn't the option for you. That's why we discussed CPAP, Inspire, we discussed everything else, all the other treatment options. But going back to mitigating tooth movement, there are certain devices that I think are really good to mitigate that. I do think the PreSonus Evo is very good for mitigating tooth movement. I think having distal wraps on your devices are good for mitigating tooth movement. When it comes to the Somnomed Avance and Herps Elite, I think they're great as well. They're actually very custom. And of course, worst comes to worst, if teeth are moving, you could always, and of course, I always like scanners because you could always take the scanner, make an Essex tray, and just get their teeth back in, in alignment again. So, but I
Gotcha.
always
And Sunny,
start on the front end.
oh,
Go ahead. I'm sorry.
and Sunny, there was no, thank you, Dr. Tai. And Sunny, there was a question actually. Dr. Tai just mentioned aligners. There was a question about making devices over aligners. Is that something that you do at Apex? What's your view on that?
We have retrofitted some appliances with thermocryl liner. Most of them would be
Okay.
acrylic based that we would hollow grind out and put the thermocryl and allow it to do that. That's kind of a retrofit is exactly what it is. There's better solutions that's coming out there. But when it comes to the mitigating tooth movement, my go-to, if that is at all a concern to the doctor or to the patient, the one I'm going to recommend the most, all of the ones mentioned are really good, but the ones I recommend the most is the EMA. It is based on a line. It's made out of the aligner principle, designed by an orthodontist. And he's 92 years old, but I'm just catching up to how really brilliant his was in the many 78 patents that he has. But
Yeah.
essentially, there's no contest. It is basically an aligner with elastics on there. And you can mitigate the retractive force by using a lighter band. So if it is truly a concern and you're trying to address sleep apnea, make yourself an EMA, cover the distals just like you normally would. You have yourself a permanent retainer and then use a lighter force band so you don't have that retractive force on the anteriors. So that's if that is truly a concern, that would be my number one goal, number one device. But like the PreSonus ones, I've seen those, they really integrate really well. And they really minimize any type of tooth movement whatsoever. But again, more familiar to patients, maybe on a tactile sense, is like, oh, this looks just like an invisible retainer. That's because it is.
Sure.
You just have that comfort zone. And again, it's designed by orthodontists. So I have comfort in research that he conducted to make sure he
Sure.
tooth movement.
Sure. And Brandon, it seems like you've got something on your mind.
Yeah, am I supposed to be honest and open here? Is that what we're doing?
Just
Don't be
say it,
shy.
don't spray it. Yeah.
I'm just not an EMA fan. And I'm not saying that I
Why?
never use it. Well, The bands wear out really quickly. Patients are constantly calling saying, my band's stretched out. I'm snoring again. I need a new band. They crack and they break for me in my hands again, not all of them. Have they changed their warranty or their
So
manufacturer
regular
warranty?
EMA, Brandon, horrible. Serena EMA.
Serena EMA is
Totally different
much better.
situation.
Yeah.
Totally
Yeah.
different situation.
There's also the milled version now too.
Okay.
So
Okay.
they're evolving. So that's why it's really, it's a great tool, but I understand what you're saying with the early breakages
Yeah.
and 100% right.
But what I will say is ProSomnus has studied this. I think they're going on 4, 5, 6 years of studies with orthodontic studies on models of patients wearing the ProSomnus Evo and IA, and they're showing like almost no tooth movement.
Well, we're doing something a little different tonight. So typically we have a lightning round at the end of the session. However, all of you know my good friend Barry Glassman, and I feel a little like him today because we're 35 minutes in and we just finished with the first slide.
Yeah, we haven't dropped
So
any
we're gonna-
F-bombs yet.
well, yet. Wait till I finish with the second slide.
Very.
So we're going to actually jump to the, and Barry just sent the message, said, I heard that. I guess he's got his hearing aid turned up. Did you hear that one too, Barry? Come on, buddy. I love you, Barry. I love you. So we're actually going to skip to the lightning round. He said, no. We're going to skip to the lightning round now. There's a lot of questions coming in. Please continue to submit those. We're going to skip to the lightning round. We're going to do something a little different with the lightning round. Not only are we bumping it up, but I'm going to show you all a picture of a device. Okay. And then I want you to share your open, candid feelings about your experiences with that device. Before we start it, though, I do want to say one other thing. For those of you that are on here and you're listening, you've heard each of the panelists speak very favorably about various Somnomed devices, numerous ProSomnus appliances, TAPs, EMAs, Dynaflex, even the Morpheus. So a lot of different devices. We don't have a corporate sponsor for this webinar. We're not paid shills, just trying to speak favorably about some device, hoping that, you're going to use them. We're here to share knowledge, wisdom, and experience so that you can take it and go forth and help more patients. So what you're getting is the real deal, what these people feel, what they've seen, and we hope that you appreciate that. So here it is. We're going to start with Dr. Hedgecock on this one with the first device, and let's keep it under 30 seconds. It's the lightning round. Let's keep it under 20 seconds. Lightning round. Okay, Elias, go. So
Panthera.
you've got a Panthera DSAD. What's your experience? What do you like, love, hate?
Super lightweight, super thin, middle-aged female, perfect teeth, wants something small, doesn't want a lot of bulk in her mouth, so to speak. That's who I would use that on. Downsides are it's a little porous, it's going to stain over time. I've had a little more like interproximal spaces open up with some of these.
Oh, you have? Okay. Dr. Lehman, Panthera DSAD, go. No. Panthera DSAD. Elias, what the hell are you doing?
My bad.
Elliot gets hammered during these things. Okay. Dr. Lehman, what do you got?
I'm not a fan.
Pourquoi?
Yeah.
I think that they stain easier than the Serena nylon, much easier. And I think those bands are almost impossible to get on and off. So patients have to come in and I don't have time for that.
Okay.
Agreed.
Dr. Tai, what would you add to that?
I mean, I'd agree with everybody else.
Okay.
It's a nice device. It's low profile. It has its place. It's good that it is a Medicare approved device. So when you have patients, especially very frail ladies that have very small mouths and small cheeks, then I think it'd be good for them. But again, like Stacey said, the bands kind of drive me crazy. It's hard to switch them in on and off. And a lot of times we want them to be able to do it at home if they can, but they have a really hard time. So they're coming in, taking chair time. So I agree.
Gotcha. And I guess based on what all three of you just said, it wouldn't pass the Mark Murphy mustard test.
No.
Okay. So, Sunny, would you say anything different? What would you say different about the Panthera DSAD?
Just the insurance. Like I said, like she said, the Medicare. I think that's the first thing
Okay.
that comes in my mind right now. Different than everybody else's is just the Medicare code.
All right. Sunny, what is this next device?
I haven't seen that one yet, but that's the EMA. It's simple, versatile, and it's ever changing. That's the new direct to print resin that's coming out. Other than that, for me, it's my go-to. I get a lot of new accounts, new doctors, and it's a safe bet. If they're not sure how to take a bite, they're not sure position, they're not sure if this is going to work for the patient, and the economy behind it, it's one of the most cost-effective next to Silent Night.
Got it. Dr. Tai, what would you add to that about the EMA?
Honestly, I don't use it often, actually hardly ever at all. And the reason being is because
Okay.
we do charge a fee. And sometimes when patients see it, they feel like it's kind of flimsy, I hate to say it, like seems kind of cheap instead of compared to the other robust devices. And so I'm sure it's great. I don't use it very often.
Okay, let's go with the next. Elias, so that, Dr. Tai, you want to roll with that with the Somnomed Avant?
I do
like it, love it. What about it?
I love it. I think it's a great device. It's very comfortable, easy first time fit for patients. Great for bruxers. Like Brandon said earlier, lots of lateral movement, lateral play. So again, I do like to add anterior excluders. And so I don't really have patients with a lot of pain. I don't see it. And so the first time fit's amazing. The warranty on it is fantastic. They have a no questions asked warranty with Somnomed for this one. I know you haven't popped up the Herps Advanced Elite, but that one's like a 5-year warranty. So it's great. I think it covers for dog chewing also. So that's very helpful as well. But as a device, patients seem to really like it. It's small. It's a smaller profile device.
Would you say that that's your go-to?
That's definitely one of my top.
Okay. Dr. Lehman, what do you think about the Somnomed Avant? When do you use it?
I think it's a really great device. I don't necessarily like anterior mechanisms because the tongue gets stuck behind that. But it definitely has its place. We've talked about some of the reasons you would use it with the lateral play and all that. The problem with Somnomed is turnaround time. You know, that's just such a huge problem. I can't go on a consult and tell somebody they're about to die and say, we'll see you back in 6 weeks.
Yeah. And customer service leaves a little bit to be desired sometimes as well.
Okay.
Tough crowd. Ouch.
Yeah, let's go to the next one. Is a Herps device. I think that's from Dynaflex Dynaflex Respire Herps. Yes, is that a pink?
Yep.
Elias, yep.
Sir. Yep.
And you know what? Let's just for the sake of this discussion, let's just roll with a Herps in general. Sunny, when do you recommend Herps to your clients? What are the pros, the cons, the good, the bad, the ugly?
Well, to be completely honest, I actually have my own Herps, but I actually recommend the Oasis Herps over my own. The Oasis Herps is my go-to mechanism. I just love the simplicity of it, the lateral play, and it's durable, and I just like the low profileness of it, and it just for the TMJ patients, which I got a lot of, having that ability to have lateral play, and you could put elastic hooks to be able to limited range of motion. The Oasis Herps, hands down, even over my own personal Herps, is a better design. Yeah, is a better design.
Well, Sunny, you know, Elias and I do business consulting. We're going to call you after this to help you out with
Hey,
that.
I built my business based
No,
on like transparency. You know, I all the devices
yeah,
in front of you. I can say
right.
I can tell you which one based on your patient's needs.
It's certainly one of the things I appreciate about you, and your clients are lucky to fortunate to have you.
Well, I'd be wealthier if I
Dr.
kept.
Hedgecock, yeah, Brandon, what would you say about Herps devices?
Yeah, we use a lot of Herps in our practice. That's probably our #1 Medicare device. I don't use a lot of this particular Herps. We use a lot of the Somnomed Herps Advanced Elite, like Suzanne said. I really like those, just the way that they're built. I like the advancement mechanism on those with the jack screw as opposed to the little barbell type things. Or we use the Evo PH sometimes as well. So very common in our practice for Medicare patients.
Gotcha. And Dr. Lehman, what about you with the Herps?
We do extremely rare that we do a Herbst. So our Medicare
What
patients,
about
we do the
Yep.
Snore Hook, ProSomnus Evo is most of the time what we do.
Got it.
I just
Um,
my big thing is effectiveness.
Mhm.
And
mhm.
I used to keep a spreadsheet, and the most effective device on the market is a ProSomnus Evo. It just is. I've seen it with my own eyes over 15 years on my spreadsheet. It just is. So it's hard for me to put someone in a device, because then what happens is I feel bad. I can't correct them, and then I switch them to an Evo anyways. So
Mm.
there are people, if I can, let me push you on that, press you on that a little bit more. I mean, there are people that would say, you know, you've got your spreadsheet, and you know, I mean, you treat hundreds and hundreds, if not thousands, of patients each year, but you've got your spreadsheet, and it's, you know, it's not a randomized controlled spreadsheet. So I mean, you just told everyone that's on here. There's 100 people that are on here right now. You just told them all that device is the most effective because your
Yep.
spreadsheet says so.
Yes, sir.
Okay.
And that's what matters
Uh,
to me in my practice. So
Uh,
you guys can do I mean, everybody can do what you want, but I would suggest getting your own spreadsheet and see what happens.
I actually have a spreadsheet as well. I stole it from Dr. Lehman, and my spreadsheet actually looks very similar to hers. Evo, hands down, we see a higher percentage rate of success and compliance with it. It's not that we don't see success with our Herps devices,
Right.
but when we're looking at 68, 72% versus 85, 89%, it's a little bit different, and that's the hard part about it. But I'm also honest with my patients about insurance coverage, and you know, if we can bill a K code and use the Evo, we're much more prone to do that as opposed to using a Herps. But
got it. Got it.
I've never used a snore hook before. So yeah, a lot of my Medicare, actually majority of my Medicare get the Herbst Advanced Elite. Because I think it is a good device. I do see, you know, they made changes from their original Herbst, and they have, I will always love that visual indicator. It's
That is
to
the
see.
best Herbst on the market, no question.
It's just nice because even when they adjust, it has this audible click that kind of happens. So you know how many times you're going, and you see the visual indicator. So if it's their caregiver or their husband, if it's like, you know, they can't see it, it's so much easier to see. So I do love it. And they do feel it's comfortable because of that B-flex liner. So a lot of older people that have these certain teeth that, you know, they might be a little bit periodontally involved a little bit, but when they have that softer liner, it just comes in nicely for them. But I understand what Stacey's saying. It's like, sorry, did I say sucks? It's kind of, it's just not, it's not fair that we have to follow Medicare rules or insurance rules on what device they make us choose, you know, because you want to do what's best for a patient. But I see what Stacey's doing. It's smart. It's like she wants to do the device that she feels best for patient. So she uses a snore hook to, you know, start out to kind of follow Medicare rules. So that's good.
All right.
All right. And then we've got so this one throwing in something quite different here. We've got a MyTap with the Shield. Who here has experience with these devices? With the MyTap
For a temporary?
provisional device? Yeah,
Oh, provisional. Yeah, it's great for
yeah.
provisional. But when you're using a lab that has a really fast turnaround, you don't need provisionals.
Hmm. Anyone want to add to that? No? All right. Well, let's go to the next device, which is a ProSomnus device. You all have talked about it a lot tonight. Do you what would you add? When do you use that? When don't you use that device? An Evo.
I don't use it when, like I mentioned earlier, when somebody comes in and they've got some really major degenerative kind of changes in their joint, loud crepitus, loud popping, clicking, fibromyalgia, hot muscles. Like I'm going to put them in an EMA, a Serena EMA. That's the only time.
What precludes a patient from getting an Evo from you, Brandon?
Medicare, and that's about it.
And
Got
there
it.
is a requirement for a certain number of teeth. You have to have
Yeah,
10,
maybe if there's a lot of
that
missing
too.
teeth.
10 upper and 10 lower. And if they don't have enough, and I'm not sure about retention for a Serena, then I'm going with a Somnomed.
Yeah,
Mhm.
same.
That's right.
Got it.
So the edentulous
Okay.
cases, partially edentulous cases, that kind of.
Right.
Got it. All right.
Between those two devices on the right, the Somnomed Avant and the ProSomnus, with my lower teeth, 23 and 24 are slightly crowded. The Avant hit it right on the money. In my opinion, the Somnomed, with as far as the comfort, when you have a little bit of crowding, the Avant, when you put it on, it's very similar to like a cushion or a pillow when you put it on. So I can see why Dr. Tai likes that as far as the delivery and the comfort for the patient. Myself personally, that's a very comfortable design. I think Somnomed did a really good job with hitting that design on the money.
I'll agree with that. When I got mine, and I have one as well, and I like it. It's really comfortable when it goes in, but it is more bulky. So I find that I don't have as much tongue space as I do with my Evo.
And then
But
Got
when
it.
you have patients with dexterity issues, going back to what Suzanne was talking about, your little old lady with a Medicare device, and you know, they fit snug and tight, but they're able to get them on and off a little bit easier, I think, because of their the B-Flex liner compared to maybe the Evo or the IA.
Thank you. Want to take a quick commercial break to invite everyone. Actually, all of our panelists were there in February of this year, but I want to invite everyone to join us at the 2025 Transform Dental Sleep Symposium. It's going to be January 31st and February 1st here in beautiful Scottsdale, Arizona. We've announced the preliminary roster of speakers. We'll add another 10 to 15 speakers in the coming months. But there's some of the initial speakers. Well, again, you all were there. Just chime in quick. Should people come to the meeting? What do you think about it? Go, whoever.
100%.
it's very best meetings for sure.
You don't do DS, go there.
It was an
Yeah,
amazing meeting. I mean, I tell you, it's like he chose speakers that were very similar to his book. And I'm telling you, if you have not read it, I'm not trying to toot your own horn or try to kiss your butt, Jason, but I'm telling you that book is amazing. And people who want to get into dental sleep medicine, they really should read it, because there's so much of trial and error when you're trying to get into dental sleep medicine and building a practice. There's so much valuable material in that book, but I felt like the meeting was very similar.
It was also great to have the medical community that was there. I think there was a good mix of the physicians that were in there giving some talks about.
That's right.
It was really nice to see some of those. talks and the collaboration that's happening.
Yeah, well, thank you. I mean, the emphasis was on bringing practical information to everyone and having, sort of energetic speakers, people that were, walking the walk, and were able to convey the information in understandable terms so that everybody could take it and go and be better with it. So we aim to do the same thing this year. Dr. Anne-Marie Morse, a pediatric sleep neurologist that was there at the meeting, said the one thing about the meeting where we kind of missed the mark was that it really should just be called the Transform Sleep Symposium, because there was, it was really trying to bridge those gaps between dental and medical and bring everyone together. So we encourage you to get registered. It sold out last year. It'll sell out again this year. I know you're thinking, oh, it's April, I got a long way to go. It'll sell out for sure. And it'll sell out even earlier this time because there's a lot of buzz about the meeting. So go to tdssymposium.com to get registered. And then one thing we're doing different this year is we are having on January 30th, so the Thursday, the day before the meeting kicks off, we're having what we're referring to as the Transform Dental Sleep Kaizen workshops. So there are 3 workshops. Each of them are basically half-day sessions focused on topics that attendees said they really wanted to learn a lot more about. So, Elias, if you can stop at the trigger, happy finger, and go back, please. We're having one session on,
Yes, sir.
on pediatric sleep disorder breathing with Dr. Michelle Weddle, Dr. Stacy Becker, and Dr. Tracy Wynn. That'll be from noon to 6. You have to register for the symposium, and these workshops are limited to 35 people. So don't
one's
think,
gonna
oh, I'll
sell
just get there and it'll be
fast.
fine. Yeah, it will sell out super fast. So it's limited to 35 people. When you register for the symposium, there's add-ons. You can add on your pediatric sleep disorder breathing workshop. The next one we've got, also noon to 6, Thursday, January 30th, is What You Don't Know About Medical Billing Can Hurt You. That's sponsored by Pristine Medical Billing. And that one will sell out as well, limited to 35 people. And then finally, we have a workshop sponsored by Sleep Apnea Leads, 5 must-have pillars of successful sleep marketing. So this will be focused on marketing your dental sleep practice. It's just $395, noon to 6, 5 hours of CE, and you can register for that. After you register for the TDS Symposium, you can click add-on and select your workshop. These will be phenomenal. You'll learn a lot. You'll grow a lot if you take what you learn there and put it into action. And that's what my book is about. It's about learning and doing the work and putting it into action. So you can check that out at Amazon. And on to the next slide. Before we jump into this next slide, Elias.
Before we do,
All right. Click on the next slide.
got it, buddy.
Yeah, thanks, buddy. We are almost out of time. If you're still on here, you will get your CE certificate emailed to you in the next 48 hours. Keep an eye out for that email. If you don't have it in 48 hours, check your spam or your junk. Check your junk for an email from us with your CE certificate. Real quick, Elias, jump to the end to the next webinar. I want to give a shout out to this real quick in case anyone does need to jump off, but we are going to go a few minutes extra because our panelists are so generous with their time and run through a few of these questions that have come through. We had a whole bunch of slides we didn't even get to, but I think tonight's, so Elias, if you don't mind
Jason?
clicking through.
Yeah. Just so you know, oops. Do you see the upcoming webinar slide?
No.
Okay.
Yep. Now we do.
Just to let you know,
yeah.
nobody has left yet. We're all good. We're gonna go a little
Yep.
late, no big deal, but this is a good call. Go ahead.
Yep. So our next webinar is 2 weeks from today, same time, Tuesday, May 7th at 7 p.m. It will be with Len Liptic, the CEO of ProSomnus, Dr. Singh, who is a sleep physician and psychologist, Scott Craig, who is the CEO of a multi-site dental sleep practice in the Chicagoland area, 5 or 6 offices, very busy practice. And then Randy Kern, who's the CEO of Pristine Medical Billing. And we'll be talking about things to be on the lookout for at the AADSM meeting in New Orleans next month. So be sure that you get registered for that webinar. It'll be a fun one.
The link is in the chat box.
The link is in the chat box, and be sure you register for the TDS Transform Dental Sleep Symposium at tdssymposium.com. So let's jump into some of these questions. We'll go an extra few minutes to be respectful of everyone's time, and then we'll get out of here. So we talked about a lot of these things. So we don't need to spend a lot of time. But when should I use a push versus a pull device? Dr. Tai, do you have any consideration there about when you use, like, let's say a tap device or a Herps, something like that? Like, when would you use a push versus a pull?
Sure. I mean, I look at certain teeth. If you are having periodontally compromised anterior teeth, then I wouldn't use anything that's actually going to pull on the anterior. So I also would be careful if you have very short posterior teeth also. So there's certain pull devices that will pull from the posterior and it could dislodge and kind of come undone. So I'm careful of that. And there's certain ones, meaning tap or Avance too. I'm careful with that. I look at the height of the teeth, and if these crowns look like they could be possibly compromised. So, but again, if you have posterior teeth that are compromised, and I'm going to go more towards anterior, possibly even Morpheus or tap, you can go like canine to canine or even premolar to premolar and pull that way if you don't have to worry about the back teeth if you're missing the posterior teeth. That's how I choose.
Got it. Dr. Lehman, I want to throw this next question your way. How much influence do you allow patients or their physicians to have regarding appliance selection?
So the physician,
I want that pink one.
none.
I want the pink one.
Physicians have no say. They don't
Okay.
get to decide. We have, I'll show you. We have this, and Licia does the consult.
Okay.
So we have the, menu of devices, and we go through and we talk about the pros and cons, and then we tell them which one we recommend. And I don't think I've ever had anyone say, no, I want that other one. They go with what.
Okay. Gotcha. Dr. Hedgecock, is that any different in your practice?
Same
No.
in our practice. We cover a few pros and cons. Here's the one I recommend for you based on your teeth, your range of motion, your mouth.
What about yourself, Dr. Tai?
I will tell them, I say, first of all, I need to look in your mouth to see if you're a candidate. Second of all, if you are a candidate for multiple devices, then I might let you choose if you're a candidate for multiple, because I feel that when patients actually choose, if they're a candidate for both or multiple, then they do better. They're more compliant. But like Stacy said, I don't let doctors choose because they're not the dentist. They're not looking in to see what exactly is a good fit for the appliance. And I believe most doctors understand that, and they know that, or most physicians understand that, and they know we're looking out for the best for the patient. So they're okay with it.
Got it. And Dr. Tai, what about, there were several questions about this too. Which appliances, which devices can I bill for the E0486 versus the K code?
Of course. So E0486, the appliances you can bill for that, there are a lot of the Medicare appliances. So TAP, Herps Advanced Elite, you have the Snore Hook, you have also the I wrote it down because I knew that was a question. So you have Herps Advanced Elite, Evo PH, Herps PH, TAP, Panthera Classic, and Snore Hook. That's E0486.
So that would be those would be PDAC devices you're referencing, right?
PDAC is TAP, Panthera, and Herps. That's PDAC. But K1027, you're looking at the new Panthera DSAD MX3, the EMA, the Avant, the Evo, the Morpheus, and the Respire. Those are the ones I saw for K1027.
Is that everyone's experience?
I just looked it up today. I knew some of them, but I was looking at others as well.
She's right.
Okay. So you want to run through that list one more time?
Sure. For E0486, the Somnomed Herps Advanced Elite, the Evo PH, the Herps PH from Prosomnus. Those are Evo PH, Herps PH from Prosomnus, the TAP from Airway Management, the Panthera DSAD Classic from Panthera, and the Snore Hook. That's E0486. As far as K code K1027, it's the Panthera DSAD X3, the EMAs from Serena Sleep Solutions, the Avant from Somnomed, the Evo from Prosomnus, Morpheus from Hallmark Lab, and Respire as well.
I've got a question for everyone. Thank you for sharing that list, Dr. Tai.
Sure.
There's a question that came through. It seems like many dentists, their entryway to oral appliance therapy was with a silent night. What's your take on the device, Dr. Hedgecock?
I probably just wouldn't use it if you're serious about treating sleep apnea. Because if you do, I'll laugh at you.
Brandon.
Agreed.
And he will.
And now we're all laughing with you. I don't know.
They're cheap. They're cheap. They do help with snoring for some patients, but then they break. And then they break again, and then they break and they break and they break and they break. And they're just not built very sturdy. And if you're looking for just a very, very cheap entry point for a patient who has no money and you're trying to just do something, maybe that would be where I would consider it.
Okay. Well, I tried to surreptitiously sort of weave in some of the questions that were submitted during our dialogue. So I think you all can return to your lives, to your evenings. So I want to say thank you.
Okay.
Yeah.
Sorry.
What?
Go ahead.
Go ahead.
Someone just asked earlier, I don't know if you may have missed it. Sunny, can you just real quick run through the appliances that you have at your lab? Someone said, hey, what kind of appliances does Sunny have at his lab?
ApexSleep.com. We make a lot of them. Pretty much the top ones, and we try to stay abreast on what's new. And so we have a plethora, like 5 different dorsals, 5 different Herps, 3 different nylons. But again, our big selling point for our lab is going to be just getting us on the phone, and we'll walk you right through it. Understanding your patient. That's the biggest gift that we can give to our doctors. I spend a lot of time in CE. I love talking to my doctors. So it's not for us, the device supports the doctor's treatment plan, and we're here to support you guys. And so it's fun right now because I've got a lot of tools that I can have conversations with. And thanks to all the partners, Prosomnus especially, and Somnomed for doing all the research that they do that allow me to have credibility on the devices and OSA period. We have to give credit to that. They've invested a lot of money in research. And for that, I'm very thankful that what I do is science. It's not an art.
Cool, man. I just put the link to apexsleep.com in the chat box because a couple people asked. Just want to throw that out there. Thank you.
Yep.
For sure. Well, thank you to each of you, Sunny, Dr. Tai, Dr. Lehman, Dr. Hedgecock. Thanks for jumping on here and being so open and sharing your time and your experience with everybody. We really appreciate it. Thanks to everyone that registered and has been here and has submitted questions. Hope that you take some of this information and put it into action, and that helps you do what you do a little bit better. We hope to see you at the Transform Dental Sleep Symposium in February. Everyone that's on here will certainly be there. We hope you'll be there as well. And we'll see you again in 2 weeks with our next webinar. Elias and I thank you all. So thank you. Take care.
Thank you all. Good night.
See you in New Orleans at the
Bye. Bye,
ADSM as
Stacey.
well. Bye. Bye-bye.
Elias. Bye,
Thank you.
Jason. Thank you. Bye.